So new folks are coming into healthcare, from Google and Facebook to Amazon, Microsoft, and companies that I've been surprised to learn are making very deep inroads. And one of those is FUJIFILM, and they don't just make film anymore. And to share a bit about what FUJIFILM is doing in AI and digital therapeutics is their Chief Operating Officer for Healthcare, Johan Fernando. Johan.
Thank you very much. Thank you. I'm Johan Fernando. I'm from FUJIFILM Medical Systems. This is the first time that we are attending the Exponential Medicine meeting. I'm here with some of my colleagues. Our Chief Medical Officer, Deeku, is here as well as a couple of other people. So we are really excited to be here. And what I want to talk about in my presentation is how FUJIFILM is going about and implementing artificial intelligence, especially related to radiology, and then talk about the 2 to 5 year outlook. So as we have heard over the last 2 days, AI is everywhere, right? So if you're getting on a plane and when the pilot engages the autopilot, or if you're trying to order something on Amazon.com or any other website, you order something and then the website tells you, okay, you should also think about ordering this one, and the bundle price is this. All of that includes AI. And then if you look at Siri or look at Alexa, all of these use AI as a basic functionality. So taking a look at AI itself, AI is exploding, especially in the area of healthcare. If you look at hospitals, and hospitals I expect to adopt the artificial intelligence in the next 5 years. Google has a partnership that they have established with Harvard as one of them, but Google has several partnerships that they have established. There are over 90 startups that are focusing on AI applications for healthcare. Then there's also other companies that have been working in this area, especially IBM Watson, that has done a great deal of work and developed partnerships with various hospitals and entities in pushing AI forward. FUJIFILM also recently established a partnership with the Indiana University Hospitals to team up and study AI and develop new imaging technologies as we go into the future. So there are various ways that AI is transforming healthcare, and here you see some of them: reading CT scans, detecting cancer for lung and skin, eye health. There's a program that Google started with a couple of their partners on looking at diabetics and the retinopathy related to that. Drug development, image analysis, telehealth, and a variety of different areas that AI is impacting healthcare. So one of the big areas also is big data, and how do you access this big data? And big data is a big challenge in healthcare, as you know, right? There's a lot of work being done in this area. There's a lot of data and images being produced every year, and image sets are getting larger and larger. For the radiologists in this audience, you know, when you're doing PET, CT, PET MR, all of these data sets are humongous. And then also, there's massive amounts of historical imaging data that is already present in PACS, in CV, and vendor-neutral archives across the hospital enterprise. So more and more EHR data is also being available because of the implementation of EHR across different hospital systems. So all of this data is available, but the physicians have seconds or minutes to really make a clinical decision. So one of the areas that AI can help really harness the potential of big data is in AI, using AI to filter out and in a quick manner provide timely and useful data to physicians to make a clinical decision. So if you take a look at how FUJIFILM has gone about implementing AI, you need to take a look at our portfolio. Our portfolio includes digital radiography, women's health, minimally invasive surgery, point-of-care ultrasound, biopharmaceuticals, new drug development. So FUJIFILM is involved in a variety of different areas as it relates to healthcare. And the area that we primarily focused on in developing our artificial intelligence is in healthcare IT. Healthcare IT as it relates to PACS, to CV, to RIS, and to the VNA, the vendor neutral archives. So this is where we have been focused on in developing our technologies and bringing them out into the market for our radiologists. So let me focus a little bit on that. The product that we launched at HIMSS, in a HIMSS conference, you might have heard about that, back in March this year, is a platform called Riley. Now, this is a research platform. We do not have FDA clearance yet, and we are working on developing this with our partners to continue to build upon this as we go forward. So the early radiology AI focus has been primarily on image analytics. And for FUJIFILM, our research has been in these areas that are listed out here, in stroke, brain atrophy, dementia, sarcopenia, bone density, liver, pancreas, and so on. So these are the areas that we are looking at and developing specific applications on our PACS, on our CV, and the vendor-neutral archives in how we go about applying AI to improve the workflow and create new future workflow for the radiologists. So there are a growing number of companies that we are partnering with, as well as our customers are partnering with, that provide AI capabilities. And these include, and these was talked about by Daniel and several other presenters yesterday and today, Cura Cloud, Zebra, Riverrain Technologies, a variety of different AI companies. So what we are looking at doing for us is in how we go about putting AI to work is having these different AI companies and their algorithms available so that when a radiologist sits at the PACS workstation, they are able to push a button and be able to send the data that they're working on in applying the AI to those data sets. So the ideal user case here is where the AI is applied to the data, and then the data is available back to the radiologists on the workstations in their native format. Because this disrupts, lessens the disruption for the radiologists, as well as it continues to build upon the case study that the radiologist is working on. So some of the challenges that we are working on right now in addressing is workflow integration, interoperability standards, and rules engines as to when AI should be applied and to what studies these AI should be applied to. So our platform that we use, we use open AI, open API, so that you are able to send the data back and forth between our AI-enabled workstations, as well as be able to communicate with the algorithms that are provided by the outside vendors. And all of this is really governed by our artificial intelligence engine, which is Riley. So this shows you a quick snapshot, a screen capture of the AI workflow on our platform. So when a study is completed and it's sent to our platform, it shows up at the bottom of the work list. And then as soon as the study is done, Riley immediately starts looking at the imaging exam and starts recognizing the body parts and the imaging study and scans for the differences between normal structure and structures that might have issues. Then it detects some features and triages patients and delivers a notification where the study should go to whichever radiologist who is best suited for reading the study. Then Riley will also use the radiologist's input and in outlining features and so on, and capture the data that the radiologist would dictate. And then the Riley platform will also list out any potential conditions of the disease from the database that it has. So this is like the basic workflow that we have for our Riley platform when a clinical study shows up on the workstation. So as a radiologist goes through and starts looking at these data sets and making determinations, the algorithms logs actions and preferences, and it also starts suggesting different protocols, reading protocols that can be used. So if you take a look at the next 2 to 5 year outlook for us and how we are going about developing this, one of the areas that we are focusing on is sarcopenia. Sarcopenia, as you know, is a loss of muscle mass and function. And this particularly happens as you go above 20 years. And for normal healthy people, there's a degrading of the muscle mass and strength. But for sarcopenia patients, the muscle mass and strength loss is much faster. So what we are looking at and working with University of Tokyo as a collaboration is using the psoas muscle. It's a major muscle, and looking at and analyzing the CT data sets to identify the attenuation and the size of the muscle for these patients, and comparing that with the regular case and cases where we have muscle atrophy. And the other areas that we are focused on is Alzheimer's, cancer, organ cancer, dementia, and bone, and so on. So in looking at this, one of the areas what we can continue to do, looking at the data sets that we have availability to, is to how we can improve patient engagement, provide with clinical decision support, as well as apply this to population health. So in the interest of time, I'm going to jump through some slides and get to... So one of the biggest issues that we have is how do we have access to this data? How do we make sense with this data? And how do I continue to work on improving the lives of patients with this data that we have? So one of the main areas that we are also focusing on is the IT infrastructure that is required. So you can see you have got data that is generated in radiology, cardiology, wearable devices, point-of-care ultrasound, and all of that, all of these different clinical areas. And these from these different clinical areas, the data that is brought into PACS, CV, VNA, and so on, and then from there to cloud and storage and so on. So the data that is generated here can be sent from the VNA, for example, into a centralized database where the patient can, where the data sets can be taken, collected, analyzed, and the AI platforms can be used to provide the AI-enabled applications. And this, we believe, will accelerate AI adoption as we go forward. So this is what Fujifilm is working on in collaboration with our partners to continue to develop the radiology solutions. Thank you very much.
Thank you. Thank you, Johan.